Good afternoon, ladies and gentlemen, and welcome to the Town of Portland Weekly Podcast. We are live here at the Town Tech Educational Podcast Studio at Portland High School, and we have our usual guests in the studio, Miss Susan Bransfield, our first Selectwoman, and our Public Works Director and Fire Chief, Mr. Bob Shea, and on the line for her first time on the podcast is a staple in the town of Portland, has been around a long time, and we certainly do appreciate it. We have Miss Ruth Maio, who is actually the administrator, director of the Portland Food Bank. And she's going to give an update on what's happening at the food bank. And last but not least, we have our Public Health Director, Mr. Russell Melmed from the Chatham Health District, to give us the Chatham Health update. So welcome all. Thank you for coming on, taking time out of your schedule. And I think, Susan, if you want to give us a little brief update on what's happening in the First Selectwoman's office.
Sure. Good to be here, Dave, and welcome, everyone. It is a beautiful day that we're recording here on the high school campus. It's really... Spring has certainly arrived, and it's most welcome. I want to let our listeners know that we are part of the re-entry post, or I guess amid COVID-19, and we are working with all of the town departments as well as many of our restaurants and other businesses in town to make re-entry back to our businesses being open, particularly our restaurants and the outdoor dining, started on the 20th of May. Some of them, I think, are still working on some of the aspects of their reentry. And I know our planning department, our building official, Chatham Health District are helping. In fact, if anyone has any questions, they can give my office a call. Also, the Portland Library is being very helpful in giving some of the information to our businesses. There's a self-certification process that the State Department of Economic and Community Development has come up with, and our businesses are going to be making certain that everything they do is in keeping with good prevention of transmission of disease, and make sure that all those protocols are being met. So give a call to the library. They'll be able to help you, and certainly my office and the planning office as well. We'll have more information on our website, as we always do, on those requirements, and I think people will find it, I think, Dave, they'll find it reassuring that the businesses have been able to make their businesses safe and prevent any disease, whether it's COVID-19 or really any disease. We want to all be safe from the transmission. So we'll continue to work on that. As part of the reentry, we're all wearing face coverings, masks of different sorts. It's kind of fascinating to see the different designs that people wear. And we were able to get some mass distribution of masks last week. Our State Representative Christy Carpino was successful in getting masks for the town of Portland. We had one morning at Adams Market that we distributed some, and also at the Portland Post Office last Saturday. I'm in touch with Christy, and as soon as she's able to get some more, we'll do another distribution. And again, that will be on our website. The masks are free. They were from Masks for Connecticut. I think Mr. and Mrs. Stefanowski have donated these to various cities and towns throughout the state, and it was really a welcome reception that we got from all the people that came to see us on Main Street last week. Very interested in learning a little bit more about our food bank in a few minutes. That's another part of the COVID-19. There's been an expansion of services, and I hope that everyone listens intently as Ruth Maio tells us more about it. Lastly, in closing, I just want to remind everyone that this is Memorial Day weekend coming up. And on Sunday, we are going to be having a very respectful, albeit small, respectful reception for Memorial Day. You're welcome to come, and perhaps you want to stay in your car or socially distance, but we will have a brief ceremony. And if you're not able to come on Sunday at 3 p.m. in back of Portland Town Hall at 33 East Main Street, you can always come by on your own time and visit the wreath and the memorial. It's really a beautiful tribute to our fallen heroes, as well as the memorial has the names of many of our current soldiers that are on there for the current conflicts. So I want to wish everyone a respectful Memorial Day weekend. I hope that the good weather brings joy to your hearts, because it's really most welcome. I'm enjoying this good weather and getting outside a lot more. So looking forward to the show.
Great. Thank you, Susan. All right. And I can attest to the self-certification. I did self-certify Connecticut Valley School of Music, and it is a pretty detailed process, making sure that all of the governor's requests are followed. And I think, the primary focus of the self-certification is to make customers and the public feel comfortable in frequenting and coming back to our businesses. So it is great. We're available to, again, through the protocols depending on what type of business that you have. The certain requirements, obviously, face masks are going to be mandatory in all business establishments, as well as we have the sneeze guards and again a pretty strict protocol on disinfecting and so forth. So anyway, but it's a great process. Also through the DC, I think, yes. Personal protection masks are available, as well as thermometers, touchless thermometers, and Bob can talk a little bit about that when he gets in and doing his portion. But that is great. Again, as far as the Memorial Day ceremonies, those are going to be at the town hall. We will be filming those, and the Portland High School Band and the Portland A Cappella Chorus are going to be playing and singing virtually. We will be playing. Kristen Novak and Mr. Sam Tucker have worked together with the band and the chorus on recording their perspective, the Star Spangled Banner, and the band is also going to be playing a patriotic march. So we're going to be playing that virtually. Mr. Tim Dickerson, who is kind of the MC and coordinating everything along with Miss Sarah Sterry Rudder. They're also going to be going around and laying wreaths at the cemeteries, and we will be filming that, and we're going to be putting that up on YouTube, and so everybody can see. So like Susan says, have yourself a very safe and happy Memorial Day weekend. And again, remember why we're all here, to celebrate our freedom and those that fought for it over the years. So that being said, let's get on with the show here. Again, we're up here at the podcast studio with the Town Tech Educational Partnership. I'm your host, Dave Kuzminski, and our first guest that would like to bring to the show for the first time, we have a young lady, Miss Ruth Maio, who has been a fixture throughout the town in various capacities. Again, and now she is the director and administrator of the Portland Food Bank. So, Ruth, thank you so much for coming on. I hope you and Nunzi are doing well and staying safe. And I know you guys are working very hard at the food bank. So tell us how it's going.
Thanks, Dave. Yes, we have been very busy. I just wanted to fill you in on the times that we're there and what we do, and hopefully reach people that might not be aware of what we're doing. We're open on Mondays. We've just started opening now on Mondays, and it's in the afternoon, 4 to 6, and it's a drive-through. And what they do, we won't be open this coming Monday because it's a holiday, but a week from this Monday, we will again provide services from 4 to 6. It's a drive-through. We enter the library entrance, and we exit the senior center exit. And what we do is we have a table there. That's all people have to do is pull up, and our volunteers, boxes are all set to go. The volunteers put the boxes in the trunks, and they're on their way. What we do at the senior center, we're open there on Thursday mornings from 9 to noon, and people call in. Chatham Court and Quarry Heights call their office. There is a form that they fill out. They can put everything they need down on that form. It comes to the senior center, and we in turn get their wishes, and we fill the boxes up, and we have volunteer drivers who drive the boxes to Chatham Court and to Quarry Heights, and they're delivered right to the senior center, to their community rooms, and the people then in turn come and get their boxes. We have a drop-in of food. If people want to make food donations, we are going along with St. Mary's Church. They're allowing us to have food delivered there on Mondays, Wednesdays, and Fridays from 10 to 2. People just come in the entryway from the school, the front entryway. There's a table there that they leave their items, and those in turn will be taken to a classroom where they're left there for a period of time, and then our volunteers will go pick up the food from there and deliver it to the senior center, where then it is shelved. We have a great group of volunteers. They've been with us numerous years, just as my husband and I have been with the food bank. When the residents do come through on Mondays, they do have to show us some proof of being a resident of Portland. We do serve just Portland residents, but it can be anybody that's in need, and we are finding some people now. It took us a little while to get started to let people know that we are at the senior center, but now we are getting people that are coming in from other areas other than Chatham Court and Quarry Heights. Now, that's probably what we're doing. I don't know if there are some questions that you might want to ask me.
Sure. Now, if somebody wanted to volunteer, Ruth, how would they contact you? Contact the town hall? How would they volunteer?
Right now, we have a number of volunteers. They can call me. We wouldn't be able to use them immediately because we have quite a large number of volunteers, and we have a waiting list. But if they just want to give me a call, and I would be more than glad to put them on our list, and when the need comes up, I can give them a call.
Sure, that'd be great. And also from a standpoint of people donating food, and again, is St. Mary's the only drop-off point that you're currently using?
Yes. Right now, we're just having all of our donations taken to St. Mary's Church. And our volunteers are doing shopping. We are going out and doing shopping for the food bank. But those items then are taken down and put in the back room. But any item that's donated should be donated to St. Mary's Church. Taken to St. Mary's Church. Sure.
And, of course, people can give gift cards or money, obviously. Money is certainly welcome so that, your volunteers can go out and help stock certain items that are, running low. Typically, is there a greater need on certain specific items that you could tell us about?
Right now, the items that we probably give out every time we make a box up are the items that are that contain meat, like small hams, hash, beef stew, tuna. Some of the other items that we are always in need of are juice, any kind of juice, snacks, fruit. Canned fruit. We can always use canned fruit. And personal items, right now we've been very fortunate to have a fairly good supply of paper items, toilet tissue and paper towels, but we're also always looking for shampoo, conditioners. Another item that we can use is pancake mix, syrups.
Sure.
And I think those are a lot of the items that, right now I just ordered a lot of peanut butter and jelly, but those are items we can always use, peanut butter and jelly.
Absolutely. That's great, Ruth. You do such a great job. And just for our listeners, how long have you been at the food bank?
I've been running the food bank probably 45 years or more.
My gosh.
I was doing it when I was with the visiting nurses. In fact, that's where I started. And I didn't do a lot. I did the baskets at that time because I was going out to make home visits, and I was in a position where I could meet a lot of people and knew a lot of needs. So the people would call in, and we had a small food bank that was located in the Methodist Church. And the secretary of the V&A would go over and pack the orders. But the holidays was probably my big thing, doing the holiday baskets. And once I retired and the V&A could no longer do the food bank, Ed Kalinowski had called me and asked me if I would run the local food bank. So this was while he was still in office, and so that was numerous years ago.
Sure.
My husband and I and my children and grandchildren are still very active in the food bank.
Absolutely, and I know you've made a couple of appearances on our Portland on the Move show between you and Nunzi and so forth, and we still have recordings of that in the archive. So, and again, we certainly do appreciate that all you and Nunzi do for the town of Portland, and it's people like you that make the town such a great place. It really is, and it's a great place for families to bring up their kids, and we take care of our own, and certainly you're a testament to that.
And it's good to hear your voice,
so much.
Ruth. It's good to listen and hear all the good things that are happening. We don't get to see one another as often, and we miss you, but it's certainly good to hear that COVID-19 did not interrupt our Portland Food Bank. In fact, you've expanded, and it's just a blessing. Thank you so much.
Thank you.
Great, Ruth. Thanks so much, and again, we'll keep up the great work and all you guys do as volunteers for the town of Portland. Thank you so much. Awesome. That was Miss Ruth Maio, ladies and gentlemen, the director of our Portland Food Bank, who has been there for many, many years and has been a staple in this town for a long time. So thanks again, Ruth. Appreciate it.
Thank you.
All right. Now, if we can, I think we'd like to turn it over to our Chatham Health Director, Mr. Russ Melmed, who is on the line. And Russ is a frequent flyer on our weekly podcast and giving us the updates on what's going around in the Chatham Health District as far as statistics and how the situation is. How are you, Russ?
Good, Dave. Thanks. Thanks for having me on again. Love having the opportunity to speak directly to people of Portland and anybody else who tunes in, maybe not even residents of Portland. Maybe it's expanding. Maybe the listening audience is growing beyond the borders of Portland. I think I'll just give a couple of brief updates on the status of the COVID-19 outbreak locally. I can confidently say now that we've had a couple of better weeks than we did in April. May has looked much better both in Portland and across Chatham Health District. We're seeing fewer new cases every day than we did in the previous few weeks, which is great, even though we've seen more testing. So what that means is we're more people are able to get tested, but we're not finding many more cases, which gives us growing confidence that we're not missing too many. We are still missing some cases. Not everybody's getting tested. There's still asymptomatic cases out there, and not everybody knows it's time to get tested. We're not at the point with testing where we would call it screening, in which everybody goes just to get checked, just because. I think that's the end game here. I think, I envision, us all waking up in the morning, spitting on a little dipstick, if you think pregnancy test style, and checking our status that morning before we go about our day. To me, that's the ideal, so that we can all be confident going about our day. We're far from that, but we have expanded testing, and we are seeing fewer new cases, which is great. And I think that gives us some confidence to go into this phase 1 reopening, where restaurants are opening with limited capacity outdoors, and outdoor recreation businesses are opening up. Offices are opening up now. I think we're on day 2 now of phase 1 reopening. which is great. I mean, I think that's all good news.
Sure. Now, has the criteria for testing changed for us? I know prior to you had to have symptoms. Or what's the protocol now?
There's still priorities. The priorities are still hospitalized patients, people in long-term care, and people with symptoms. But we've now expanded quite a bit to be testing a lot of our first responders, even if they don't have symptoms. You can now, if you think you've been exposed, or if you know you've been exposed, you can have a conversation with your doctor, and your doctor can order you a test. And I just want to caution, I'm not saying it's a good idea or bad idea, but I just want to urge caution in interpreting tests for people. So when you get a test today, let's say you don't have any symptoms, and it tests negative. In that moment, when you had your sample collected, that means you didn't have COVID-19. But it doesn't mean that you can have any confidence that over the next few weeks you will continue to not have COVID-19. So I think the testing is more important to find cases who are positive who didn't know it. You can, if you had an exposure and you test negative, you can feel good that in that moment, again, you don't have COVID. But testing really is intended at this point to find infected people. To find infected people who either didn't know it or who had mild symptoms and suspect they have COVID so that they can isolate and stay away from others so that they don't get anybody else sick. That's really the goal right now of testing, is to find out who is positive and keep them away from others. And then to find out through contact tracing who came into close contact with that person and tell them to stay in quarantine for a couple of weeks. So testing has expanded. You just need a doctor's order or a pharmacist's order. It doesn't have to be it can be a doctor, it can be a physician's assistant, it can be an APRN can all order tests for you, as can a pharmacist. As of, I believe, the 14th of May, a pharmacist can now order it. And that's why you saw in CVS has greatly expanded the number of drive-through self-swab testing sites. There's one right next door to Portland now in East Hampton. So the CVS in East Hampton now has a testing site, and the pharmacist there essentially can order it for you. You don't have to meet with the pharmacist, but you do have to go onto the CVS Minute Clinic web portal and answer a few questions about why you think you need to be tested. And if you answer the questions appropriately and you meet the criteria for them to be tested, they'll give you a time slot and a day, and you just drive in and you get tested through CVS. So I think that's great news. It had been just one testing site that CVS had been running in New Haven for a few weeks, and now I think it's at 10 or 12 other locations, including really close. So you don't have to drive to New Haven to go to that testing site. Great news. Some of my staff have actually gone through, and I know that a number of other essential workforce staff have gone through the Minute Clinic to get tested, and it's a quick experience, and you get results fairly quickly, so that's good.
Sure.
So Russ, Bob here. Just one question on the testing, if you can clarify it. You might not be able to, but I think you will. So if I was asymptomatic maybe in March, and I was going to go and be tested now, is this test going to pick something up, or is there a time frame from when you're exposed, when you have the disease, and then a certain time frame after where it won't be picked up on this particular test? Then you'd have to go into what we would call an antibodies test.
I think I got most of that. You're breaking up. I'm not sure if it's my connection or yours, but I think you were asking if there's some kind of, if you need to wait from the time you think you were exposed to when you should go get tested to see if you were infected. Am I getting that right?
Yeah, I'm wondering if this test that's offered out there now, Russ, will show that you're positive, even though you may have been way back in March? Or are those individuals really looking for the antibody test later? Is there a period of time where you may have been infected, but your tests that we're conducting now won't pick that up because obviously you've gone through the process and you're healthy again?
Right. So every test has a range of their sensitivity and their specificity. Sensitivity is the ability of a test to detect small quantities of virus in this case. specificity is the degree to which the test may find you positive when it really wasn't COVID, or find you negative if it really was. And that actually varies by person depending on when you were exposed. Everybody is going to progress through their disease state, through their infectious state differently. Your body is going to develop, the virus is going to replicate in your body a little bit quicker or slower depending on a number of factors compared to somebody else. And so there is always that chance that you go to get tested and, you got exposed. Let's say you have a known exposure. Let's say you went out and you went out, if you're a firefighter, and you went out on a call to a structure fire, and there was a resident there or somebody you work with, and they had COVID, and you find out they had COVID the next day, and you want to get tested because you were with them that day. The wisdom of going immediately to get tested is uncertain. Again, if you get tested, if I get exposed today and go get tested tomorrow and it's negative, does that mean I'm in the clear from that exposure? The answer is not necessarily. So testing is imperfect, which is why I think the ideal is at some point down the road, testing everybody frequently. Frequently given exposures and no exposures, so that, we all know, because again, this is can't see the virus. You don't necessarily know who you've been around, who's been sick, may have been exposed and not know about it. And if you wait until you're obviously symptomatic, you may have exposed others in that time. So, testing, it's still not where it needs to be, and interpreting the results given a certain exposure and the duration of time since that exposure is still a little bit uncertain. Did I answer your question, Bob?
Yeah, I think so. I mean, the biggest thing is, I have quite a bit of staff that may have been exposed early. They're not sure if they were asymptomatic and may have had it. And, they're looking for that antibody test, and they're wondering if
antibody testing.
Yeah, if they're wondering if this test, which public safety is available to go for now without symptoms, would actually show if they had the disease 2 months ago and are cured.
Right.
And that's the gray area. It's like, okay, we have this test.
Still is.
And now we're waiting for
the issue of antibody
test.
testing is still being worked out. The issue with antibody testing for you and for our listeners is, what you're looking for is the body's immune response to an infectious agent. And the way those tests are developed is test developers take the virus and they pick a certain surface protein, usually, that's found on the virus, either the viral envelope or some other part of the virus, and they replicate that protein and they put it on the bottom of a plastic slide, and then they bring in serum from somebody's blood onto that protein. And if the antibodies bind to that protein, then they can detect it. The big question is, which antibodies should we be looking for? And more importantly, of the universe of antibodies that your body might develop in response to COVID-19, which are the ones that confer protection from future infection? And those two questions I don't think have been fully answered. Which are the best antibodies to be selected for antibody testing? There are a lot of antibody tests out there. Some are FDA approved. How we interpret the results is still a big question. And do those antibodies that you might have, do they suggest that you're protected from some future infection? Still hasn't been fully answered yet. So I don't think we're there yet, Bob. I really am looking forward to the day when we have those answers and we can all get screened. There is a study that's being done right now on blood donors. And it's being done in a number of big cities around the country. They're taking samples from routine blood donors, and they are looking for antibodies using these various antibody tests. And that'll give, the hope is to give us a picture of how far the infection spread in those communities. Is it 10%? Will 10% of blood donors show antibodies? Will 20%? Will 30%? Will some smaller number? So I think the antibody tests question what it means in terms of protection, what it means in terms of where you actually expose. And again, antibodies, there might be cross-reactivity between antibodies for COVID-19 and other coronaviruses. So if you show positive, does that mean it was definitely COVID-19? Or could it have been some other run-of-the-mill coronavirus that gave you a cold last year? We just don't know. Don't know the answers to some of those questions yet.
That's good. We're moving forward,
But
and just the availability of more testing is just a huge benefit. So thank you, Russ. I appreciate that.
yeah.
Great, Russ.
So before I suck too much of the air out of the room, getting into the nitty-gritty science of coronavirus, I want to mention one more thing, and that is about reopening and what citizens can do if they have concerns about what they see when they're out and about. The governor has built into one of his executive orders a complaint mechanism and an enforcement procedure. So citizens who may go to a restaurant or work in a restaurant or work in an office that's just reopened, if they have concerns about things not being done appropriately, people not wearing masks, people crowding together, hand sanitizer not being available, things like that, they can either call 211 or there is a very handy online and pretty simple form that people can fill out. All you have to do is Google reopen Connecticut complaint, and the first thing that comes up will be a Department of Economic and Community Development online complaint form. And so citizens can go on there and they can document and they can report whatever they saw that concerned them. And because the follow-up, the monitoring, the enforcement has been spread out across various entities and agencies, from public health to the police department to other municipal designees, that form, depending on the nature of the issue that somebody witnessed, will get to the appropriate agency. I think there are a number of advantages to using this sort of centralized system, and that is that we can monitor and track the volume of complaints across the state, regionally, in a particular town. We can monitor. We can see, are there more complaints in one particular sector than there are in another, and people can feel confident that their issue is getting to the right place. So I'll also say, as I did last week, that if I give everybody out there who's listening permission, if they are in a workplace or they are in a business and they see behavior that makes them uncomfortable from a disease transmission perspective, to calmly remove themselves from that situation. If you don't feel safe, just as anything, you should feel comfortable removing yourself from that situation. I think it's fine to have discussions with our friends and neighbors and people out and about what they may or may not be doing, but tensions are a little bit high. Everybody's a little bit worried. What I don't want to see, and I don't think anybody wants to see, are confrontations around social distancing that may escalate. So I just want everybody to be patient and to feel comfortable, removing themselves from a situation if they don't feel safe.
Sure.
But there is that direct and that uniform point of complaints to be lodged, and if it's a public health issue, that's something that's in our purview, for example, in a restaurant or a nail salon, a pool, or things like that, it will get to me. It will get to Chatham Health District. If it's something else, it will get to the appropriate officials. So we're already starting to get some of those things rolling in, and just so everybody knows, we do respond to those. So
great, Russ.
Hopefully everybody can,
Thank you. Hey, before you go, also, and I think being that we're getting to the close of the school year and so forth, and graduations are upon us, and I know I had a graduation meeting this morning with our school principal and superintendent, so I know parents are anxious and they want to have some type of graduation, and just if you can just give a sense of what's happening and what people should expect.
Yeah, so there's a range of things that I've been in a lot of meetings with superintendents for senior graduations, with elementary schools for sixth grade commencements even, and people can expect to see a range of socially distant graduation ceremonies. The safest of which is happening in a number of places, are completely virtual graduation ceremonies where everybody is on some kind of virtual communication platform, whether it's Zoom or Skype or GoToMeeting or something else, to some are doing drive-through graduations where people Seniors will come with their families in their car, and they will sit there, and there may be speeches broadcast on screens with microphones that might be typical. Some schools are also looking at doing radio frequency broadcasts, Dave, which maybe you can share with our listeners what that looks like. But people will tune into an empty frequency on the radio, and the speeches will be broadcast on the radio transmitter to hit that frequency. So people sit calmly in their cars with their families. They listen to the speeches on the radio, and then they're called up car by car to get their diplomas.
There you go.
There are also variations on that where seniors will come in their cars, park in the parking lot, and so not a typical drive-through, but they'll be called out of their cars one by one, and they'll go up onto the stage, they'll grab a diploma, they'll get a picture, then they'll go back to their car that's parked, and then the next person. So all these things are intended to have some kind of ceremony acknowledging all the hard work and success of our graduates while keeping everybody safely, physically apart from one another to prevent a transmission of the virus and a possible outbreak. So I think that's what people are going to be seeing with graduations over the next month or so.
Sure. Great. Well, hey, that's great stuff, Russ. Thank you so much. And again, I appreciate the taking time out of your schedule to be our frequent flyer here on the Town of Portland podcast. So thanks again. And that is Mr. Russell Melmed, who is the Chatham Health Director for the Chatham Health District. And again, Russ, thanks so much for the update. With that, we're going to turn it over to batting cleanup right now with Mr. Robert Shea, who is the both the Public Works Director and Fire Chief. And so, Bob, what's happening on your end?
We're trying to stay as busy as we can and to stay on the same pitch of cleanup. We're just finishing up our road sweeping program. We should be pretty close to the end, if not complete, by Friday. Supervisors have reported to me this week that they're doing very well. The weather has been really good this week, so we've made some headway. And as we've made changes to the way we do business in town related to our roads, it's made it much easier to keep them clean in the spring and get what we have for really runoff now for sand and miscellaneous debris. We've probably reduced the time for sweeping by half, if not more. So that's a cost savings for us on manpower, fuel, and equipment. So I think that's working out well, and we put that right back in and utilize that during our winter months. So the program seems to be working out. Thank you for the patience of people being home and using the roads to park their extra vehicles. And they were very cooperative and thankful to the employees that were sweeping, and they were out moving their cars in advance as they knew that the crews were on their roads. So we really do appreciate that. That makes it much easier. No potential damage to vehicles. And it certainly does a better job. It's always nice to go down to a road that's freshly swept without all the zigzags around parked vehicles. So we do appreciate that. Thank you to the residents that made that happen. And we're in advance of our trucks, which makes it great. We can continue to go, and we don't have to keep stopping to lose time. Just a reminder that there is no brush pickup this year. And we do have a few piles that are out there. They went out probably early in the year, and those are going to have to be removed by the owners. We hope that they could do that to make sure that those don't become an issue, some of them in relation to sight lines. So we're making sure that those individuals are notified and reminded. But there is no brush pickup, but you can certainly, with a permit, bring it to the transfer station, which is extremely busy, to say the least. We're doing our best down there. Our brush pile is growing by the minute. So we're hoping to make sure that, just as a reminder, please, it's very busy down there. There's only 2 employees. They do their best. They certainly don't want to engage. We're doing our best to keep it open, and we are asking for all the cooperation from those using it, that they follow all our procedures at the facility and use it accordingly based on the rules. We'd really appreciate that. That way we're limiting our contact, and it's a smooth operation for everybody. So just a reminder on that. All our departments, water, sewer, they continue to work to maintain our facilities. Sewer department is still struggling a little bit with pump failures due to rags. So we're just reminding everybody, as I do every time I have the chance to be on this, that we just simply can't flush anything but toilet paper. We've lost 2 pumps during this epidemic so far, which is very costly for us and as well as difficult for those who have to replace them, especially in the environment that is hazard for them, very hazard. So if you read a little bit about it, COVID is in wastewater, and just puts a risk to our employees when they have to do repairs such as that normally they would not have to do. And it's costly to the town and the taxpayers. So just a reminder there. But we'll be out. You'll see our crews working as close as they can together, but using protection and precautions as they've been instructed to do. We'll be beginning crack sealing and tree trimming and road repairs and curbing and topsoil replacement from areas that might have been damaged from this winter, as we always do, increasing and making changes and improving some of the park areas that needed some pruning and drainage, as well as repairs to the parking lots. Maple Road is something I talked about, and we were planning on actually starting that sometime in mid-May. That's been pushed, and really it's because of the contractors coming back to work with their unions a little slower than we had thought. So that's going to hopefully start. It's a drainage improvement at Maple Road about the second week of June. So that's still on. We've notified all the residents there, but we certainly are very anxious to get that work done and completed. It won't take too long, but there'll be a disruption there for a while as far as the road being closed in that lower area of Job's Pond and Maple Road just during the day during construction. Salt shed improvements will continue this summer. That job is out to bid. We're looking to make some great improvements to our facility up there to protect our water infrastructure as well at the same time. And the work on the park entrance and new road configuration is just becoming to the point of completion. I'll be making some inspections out there with my highway department, make sure all the safety and changes that have been made are compliant as we move the frontier lines up and start removing some of the poles to the new configuration. We're hoping that's done the end of this week. We'll be taking a very good look at that to see if we can kind of reopen that road and start traffic back through Strickland Street onto Route 17 or Gospel Lane. Just during that time, people have to be very, very cautious. It's a different entrance. The entrance is a little different. The approach needs to be made with caution, especially when you're coming up and around that area. So other than that, Dave, that's about highway, fire department. We're steady.
Great. All
We're
right.
steady out there, trying to stay healthy. And
the bridge construction is coming along?
Bridge construction's moving very, very well. My next meeting with the chamber for the public safety side of it will be on Tuesday, I believe the 26th. So I'll have more information, but as you can see, if people are using, traffic is starting to build up. There are some delays. They do occasionally have to shut down a lane as if they're moving stuff over the Jersey barrier to load, but I think they're past that stage now. Some weekend work on Saturdays has definitely been scheduled, but it seems to be working well. The majority of the deck on the Portland side, including the sidewalk on the approach, has been removed, and they're starting some steel work, which is the biggest part of the improvements. And there's been an awful lot of work on the Spring Street new entrance and exit, which is open and reconfigured, and the center median along the Middletown entrance in St. John's. And if no one's driven around, there's a new lane being put in on the Hartford Ave, we call it, which is going to give you a single lane approach around the diner without being in those 2 lanes of traffic to go to the bridge. So that's going to hopefully help with Main Street traffic. So you can see they've made good progress down there as well. Most of that road is removed, and hopefully that road widening project will be completed as well. So far so good. Still on schedule. That won't change, and they won't give us an idea for at least a year on that. But be cautious when you're going over the bridge.
Great. Thanks so much. Awesome job. Okay. I know, Susan, you've been up to your elbows in the the budget process.
That's a polite way to say it. Yeah.
So I know it was a fairly a late night last night. So I don't know. Maybe you just want to recap that a little bit.
Yeah, sure, Dave. The budget season is winding down, and last night, which was Wednesday evening, the 20th of May, the selectmen have gotten pretty close to their final decision making, and probably, Dave, not anyone is totally happy, which is usually the good sign that I think there's a little bit of angst among everybody involved. But I think the bottom line is the selectmen work so well together, and the questions that they had and some of the observations and the intent is, let's make sure that we're delivering and able to continue to deliver the necessary services that the town provides at a reasonable cost. And the expectation of our town is that we make sure our finances are in good shape. And I'm happy to report they are in good shape, and we intend to keep them that way. And so we'll meet again on Tuesday, May 26th. And if we finish, we will not have to meet again on Wednesday. But being cautious as the selectmen are, we suggest that they meet on Tuesday, and then we can always finish the work by Wednesday. All of these meetings are available by going to our website, and there's an easy access through the Zoom network, and you can listen in. And it is not a time for public comment. That public comment phase has passed. But I can say I'm rest assured that this Board of Selectmen will do the best job that they can, given the very, very difficult circumstances that we are all experiencing in light of COVID-19.
Great job. I know you make spend many late nights in the office, and working so hard. So we certainly do appreciate all your efforts. And again, the whole Board of Selectmen, I think there's a good synergy there, and I think they will represent our citizenry very, very well throughout this challenging time, so to speak, but that's great. So, all right, I think that about brings our episode number 9 to a close here at the Town Tech Educational Podcast Studio. Again, we do our podcast on Thursdays, usually at noontime, with very, very special guests each week on a variety of topics. We also do the post-production. Our engineer, Mr. Kevin Armstrong, is here in the studio and puts the visuals behind it. So we also get that over to the Comcast studio on Channel 15, and that is aired on Tuesday. We got a news flash.
Well, it's actually just one thing that was handed to me, and that is if you're a small business and you need masks for Connecticut, there is a Connecticut Business and Industry Association order form link that you can go to, and it is www.ctcovidresponse.org/request-masks-for FOR-CT-small-business. And Mary Dickerson, our development planner, will have this on our website, and Kevin Armstrong will make sure it's up there. So
great.
Thanks.
Awesome. Fantastic.
Hi, Susan, can I just add to that for a second?
Oh, yeah.
So in addition to that PPE request for small businesses, the Department of Economic and Community Development, in partnership with the Department of Administrative Services, has made a fairly long and comprehensive list of suppliers in the state for other things that small businesses might need to reopen, like plexiglass dividers, disinfection wipes, hand sanitizer. They have gone and produced and vetted this list of suppliers. So if you Google DECD COVID suppliers list, you will find that website, and it is a long spreadsheet, Excel spreadsheet with a list of all those suppliers. So maybe Mary can add that to the website.
Yes, definitely.
It's out there, so hopefully that's a good resource, I think, for everybody wondering, where can I get plexiglass dividers? And
right.
I'm having a hard time finding disinfection wipes. Where can I get that?
And as I mentioned earlier, our Portland Library is available at 860-342-6770. 6770. And they're very resourceful and can help you find these if you didn't have your pencil ready when we were giving you those websites and so forth. So thanks, Russ. That's good advice.
Great. Thanks again, everybody. And again, new this week, our podcasts now are being uploaded to iTunes. They're going to be uploaded to SoundCloud, Stitcher, and Spotify. So any place that you get your podcast information, we've got a link, going to be a link on our website. And one of our students, Mr. Nick Dawson, has done a great job in linking all of that RSS feeds so we can get our information out there. And we've been getting a tremendous amount of listens. We're averaging anywhere between 200 and 800 listens per week on our podcast. So, and again, we certainly do appreciate your engagement, your listening, and hope you find all of this information useful. So on behalf of us all here in the Town Tech Educational Podcast Studio, I'm your host, Dave Kuzminski. And until next week, stay home, stay safe, and wash your hands.
So just wash your hands. Don't touch your eyes, your nose, your mouth. Social distance, avoid the crowds. Fight against the corona. Practice good hygiene and keep your personal space clean. Respect the social distancing. Fight against the corona. No matter Asian, black or white, the corona is colorblind. Together we can win the fight. Fight against the corona. Stay ready today, and tomorrow will be okay. Together we can win the fight. Fight against the corona.